Welcome to the Theological Lens, where our goal is to see the world, our daily walks, and our worship transformed by the truth of Jesus Christ. Our content is saturated with Scripture, overflowing with faith, and rooted in the good news of the cross. Each episode will proclaim the name of the Lord, calling us to submit to His ways and live lives that glorify Him. With hearts full of thankfulness, we'll explore how Jesus shapes everything, our decisions, our worldview, and our worship, always pointing back to the hope and transformation found in Him.
Hello, everyone, and welcome to the Theological Lens. My name is Dr. Linnell Buchanan. I am so glad that you have joined me today. Now, a couple of weeks ago, I released an episode that I was talking about what I see as a very dramatic shift in the way that we think about and treat children and adolescents with gender dysphoria in our country. And I think, honestly, it's a long overdue shift. And this stemmed from two current events that were really very important. The first of which was the first successful lawsuit by a detransitioner against a psychologist and a surgeon. And the detransitioner, a young woman, argued that as a minor, they had done surgery and removed her healthy breasts without considering less extreme interventions, and certainly without full disclosure for her and for her parents. So she really argued that this was medical malpractice without true informed consent. She was successful. The jury granted her $2 million. And then right after that, suspiciously right after that, the American Society for Plastic Surgeons issued a brand new statement on their recommendations about gender-affirming surgeries for minors. And they said they now, different than before, recommend that those surgeries be delayed until adulthood. And right after they issued that, then the American Medical Association issued a notably weak, but still at least it was there, statement saying they agree with that recommendation that they should be delayed until adulthood. Yay. So in the middle of that episode, I mentioned the WPATH organization, the World Professionals Association for Transgender Health, referred to as WPATH. And I mentioned in that the WPATH organization has a bunch of scandals that are really attached to that organization. And so a few of you reached out and said that you would like to hear more about what has happened with WPATH and how that has related to this issue related to care for children and adolescents with gender dysphoria. So we're going to dive into that topic today, and it is a Lulu, so buckle up. So for those of you who are not familiar, WPATH is an international organization. It was founded in 1979, and it says that it's dedicated to promoting evidence-based care for transgender and gender diverse individuals. That's what it argues that it's about. And so it publishes something called the Standards of Care, and we are now on the 8th edition of their Standards of Care. And the thing that makes this organization so powerful is so many countries and medical organizations have adopted the WPATH Standards of Care as the ultimate word in how transgender children and adults should be treated. So this most recent edition of the Standards of Care is from 2022. And again, guidelines for medical professionals, healthcare providers worldwide. And so these standards of care are influencing policies and procedures in clinics and in hospitals. Even government health systems are governed by these standards of care, and they are advocating for this gender-affirming care that includes things like puberty blockers, hormone therapies, and surgeries. So for children pre-puberty, what WPATH says is that the only thing that they recommend in regards to gender-affirming interventions is psychosocial support. But when they are describing that, what they are including includes an exploration of gender identity through choices in clothing and hairstyles and name and pronouns and play preferences. Well, they would also recommend providing some family counseling, maybe some mental health support, and some education to reduce stress and stigma for the child. And you will note that everything in their list is to humor the child's desire to present as the opposite sex. And this is very different than what care used to look like for children with gender dysphoria. So I want to kind of give you a little bit of background to that so you'll understand that WPATH's recommendations are really in a wildly different direction than what we have seen be successful in the past. And this is why it's so important for us to grasp this. So I'm going to give you the example of Kenneth Zucker, who is a Canadian psychologist, and he has specialized in gender identity throughout his whole career. He served as the psychologist in chief at Toronto's Center for Addiction and Mental Health, and he headed up its Child, Youth, and Family Gender Identity Clinic from the 1980s to 2015. So he'd been doing this for a while, and that environment really was a pioneer, so much so influential that he was the one who chaired the DSM-5's group on sexual and gender identity disorders, helping them establish what came out in the DSM-5 in regards to diagnostic criteria, et cetera. And he's widely published on gender dysphoria in youth. So this guy was an expert, but his approach was often termed watchful waiting, or sometimes referred to as a developmental biopsychosocial model of gender dysphoria, because what he emphasized was reducing gender dysphoria by helping children and adolescents become comfortable in their biological sex rather than immediate gender affirmation. He would say to parents, it is absolutely in your child's best interest that they not continue in this dysphoria. So you as a parent should not humor what they want. You shouldn't allow them to dress in the clothing of the opposite sex or use the other gender's names or pronouns or anything like that. He said, no, that's not good for your child. Instead, you should do everything possible to get them to identify in their biological sex that's going to have the best long-term outcome for your child. So for these children, pre-puberty, it involved things like play therapy. He focused on parent counseling and addressing underlying other factors like social obstacles with peers that could be a problem, or unhealthy family dynamics that could be a problem, or some co-occurring mental health issues. Let's deal with those. And we're going to hold off on this gender stuff until they're adults, because what he knew is that their research had been consistent over and over and over again, finding that if children were not affirmed in this kind of delusion, but instead they were encouraged to identify with their biological sex, then by the time that they went through puberty, somewhere between 86 to 90% of them would become comfortable in identifying with their biological sex. So the fact that nature would have an 86 to 90% cure rate on gender dysphoria if we just let it do its thing and don't interfere, don't affirm what the child is thinking. Instead, we work with them to identify with their biological sex. So turns out there were people who weren't happy with Zucker over this. In fact, critics were absolutely furious that he did not immediately affirm this delusion, this feeling that is actually very impossible to describe or define. How do you know you feel like a female? How do you know what that feels like? It's really a crazy thing. So they accused him of pathologizing the child's self-determination, even going so far to label his process a form of conversion therapy. So he was fired in December of 2015 after the hospital did some evaluative process, and they ended up closing down the gender clinic there due to this activist pressure, and also because Ontario was about to pass a ban on conversion therapy, and they were worried about, those activists that were accusing him of a form of conversion therapy. So the review that the hospital did found that the clinic was, quote, out of step with current practices, unquote. So they didn't say there was a problem with his science or his processes, besides the fact that other people in the more current age didn't agree with him. Oh, okay. And they instead favored intensive, invasive medical treatment over this supportive, watchful waiting, and suggested that, that watchful waiting, it may be a little bit reparative. It may be a little bit too conversion therapy for gender identity. And so the report also included some very unsubstantiated allegations, including one that said Zucker mocked a patient's body, and that was later deemed to be erroneous. Oops. So Zucker sued the hospital for defamation and wrongful dismissal. And in 2018, they settled for over $500,000, plus an apology for the flaws that were in their review of the clinic. But they still kept the clinic closed. He didn't get his job back, et cetera, et cetera. And they were citing the fact that the clinic did not meet the needs of these transgender or gender expansive youth. So remember, Zucker's approach was that it's a much easier path for a child who thinks that they are transgender to come to peace with their biological sex and to identify with it, to settle into the roles and presentation of that biological sex. And research had found very, very consistently that often this gender dysphoria in children is a feeling that can be very transitory. It can be very short term, and they might move through it and out of it. And the vast majority of these dysphoric children would find those feelings alleviated after going through puberty. And they would settle very comfortably into these roles and expressions of their biological sex. Remember, that number was like between 86 to 90%. So Zucker did recognize that there would be some adolescents who would continue to feel dysphoric even post-puberty. And he did not have a problem with them receiving those medical interventions when they were adults. But he felt like all of those medical interventions needed to be delayed until adulthood, just for reasons of informed consent and wisdom. So it was a very common model that Zucker was practicing before activists blackballed him right out of the profession. And these new approaches these activists were advocating for were supported by WPATH. But they ignored this high rate of children who would desist from the feelings of dysphoria and who would come to peace with their biological sex if they are left to have their normal puberty, to move through that process, and that would be the result. Instead, WPATH recommended that parents indulge the desire of their child to present as the opposite sex. And then, as soon as they reach Tanner stage 2, which is a biological stage related to the signs of incoming puberty, and is as young as the age of 8 for females and 9 for males, that as soon as that happened, they could receive puberty blockers that would stop them progressing through the hormonal and physiological changes of puberty, because that might be distressing if they identify as the opposite sex, but they start developing secondary sex characteristics that correspond to their biological sex. Now, WPATH and the trans activists argued that these puberty blockers would just delay. They would stop the sexual development for a little while, because that could be upsetting to the dysphoric child, and that would allow them time for exploration of their gender. It would give them more time to be sure of what they wanted. And they falsely stated over and over and over and over again that these things, the effects of these puberty blockers, were fully reversible and there would be no long-term negative side effects. And this is actually malarkey. So I did some research. I pulled some statements about this from different organizations and professionals. I just want to illustrate to you, I only pulled a few of the many, but I want to illustrate to you that this was a narrative that was advanced over and over and over again to these families with gender dysphoric children. We're just going to pause the puberty and there's no problem. This is something that will be fully reversible. So for instance, WPATH itself, in its standards of care, all of them that were from SOC 7, so the Standards of Care 7, 2012, earlier, et cetera, they described puberty blockers as, quote, fully reversible interventions, unquote. And they said they had no lasting undesirable effects, framing them as just a way for families to buy some time for exploration regarding gender without any permanent harm. And so this was echoed in their promotional materials. They had brochures about it, et cetera. And that led guidelines that were determining and recommended care across the entire world. So the Endocrine Society, they also said in their guidelines, you can look at theirs related to the 2017 update, they assert that Puberty blockers are safe and fully reversible and allow youth more time to make decisions about transition, with effects the resuming normal puberty upon discontinuation. As soon as you stop taking the puberty blockers, you'll just go through normal puberty as if it'll be as if those years never even happened. The Human Rights Campaign, which is an advocacy group, and other advocacy groups like the National Center for Gender Equality, they produced materials that were given to families with transgender youth, and they said they're fully reversible with minimal long-term effects, and they're just used to pause puberty, give time to think, absolutely presented as harmless, safe and reversible by time. This language was everywhere about this, and even doctors like Dr. Helen Weberly, who is a transgender healthcare provider and probably more so an activist. She said both in public statements, in videos, she claimed puberty blockers are fully reversible. Except they're not. So most organizations have actually changed their verbiage now, and they don't say things like that because it feels like grounds for another lawsuit. That promise of being fully reversible turns out to not be true. There are long-term effects on a variety of the different physical systems of the body if puberty is disrupted. For instance, bone density is disrupted long-term, which could, by the way, affect height and size, even if you stop the blockers. That those effects can be longer term. Fertility, sexual development, and this has been a problem because when you have a youth that was blocked from having puberty, then their own physiological parts did not develop. So when you have a situation like a biological male that later would like to transition to be female, and so the doctors say, no big deal. What we'll do is we will take either your penis or your testicles, we'll turn them inside out and make it into a vagina, as if that's the way this works. They didn't have enough tissue because they didn't go through a normal puberty. So it wasn't even successful from that standpoint. Even body composition things are changed long-term. Brain development can be disrupted long-term because of this delay to be this blocking of puberty. Even if the child eventually stops the puberty blockers, these effects can radiate into their future. So WPATH's standards of care that encourage this puberty blocking came at a substantive biological cost to these children and then to their families. And then a funny thing happened. Remember how research used to consistently find that the vast majority of dysphoric children would settle comfortably into their biological sex after they went through puberty. It was like 86 to 90%. That's a really, really high rate. Well, it turns out that if you block them from going through puberty, they don't settle into their biological sex. In fact, the numbers ended up absolutely reversed. That if you block puberty, more than 90% of the kids who block puberty will go on to have cross-sex hormones and further medicalization. Great. So it is notable that WPATH would say that these surgical interventions for minors remained very, very rare. And they were typically deferred until adulthood. No big deal there, assuring us that we would not have to worry about that. And also, don't worry, in most cases, parental or guardian approval is also required. So we've got adults who are checking in on this. And at the same time that they are comforting us about, don't worry, parental approval is required in almost all cases, the people who served in leadership of WPATH were pushing for parentals, for parents who are non-affirming of gender identity issues or gender transitions, that they should be stripped of their parental rights because they're abusive. So they're saying to us, don't worry about these kids who want this medical treatment because their parents are keeping an eye on them. But if their parents disagree with them, then we're going to tell states that they should be stripping those individuals of their parental rights. And at the same time that they were telling us how rare these surgical interventions really, really are, like it hardly ever happens in minors, they were lobbying states to stop those states from any laws that would limit surgical intervention on minors. And it turns out that those surgeries that were so rare were not rare at all. It turns out that there have been at least in the last 10 years, and most people think these are wildly underreported numbers because they're not giving you the full reflection. At least 10,000 surgeries in the United States in the last 10 years on minors. And the vast majority of these were radical mastectomies that remove healthy breasts from young girls. That's the majority of them. There were a few phalloplasties in there, but the majority of them were cutting off the healthy breasts of young girls. So even pre this 2024 leak that we're going to talk about in substance, there were some criticisms of WPATH that were very much deserved. The first one was that there was a lack of methodological rigor and transparency in how they actually developed their guidelines. So there was a 2021 systematic review that was published, and they said that their guidelines relied on lower quality primary research, majority expert opinion, and lacked formal grading of even the quality of the evidence. And then a 2023 article highlighted some really significant criticisms from an author who noted that not only were they not assessing for the quality of the evidence that they were citing willy-nilly, but they failed to transparently report commissioned systematic reviews, the ones that they commissioned and then didn't like the outcomes of, and then that they hid the results of, and that they sometimes presented evidence strength, quote, at odds with what their own systematic reviewers found. So, the evidence is so conclusive, except that's not what researchers found, even their own researchers. Others would criticize them on depending on expert consensus instead of strong systematic reviews, saying that WPATH guidelines were more consensus-based expert opinion than strictly evidence-based. And some described their approaches as experts writing, quote, whatever they felt like, unquote. That's how these processes were being developed, not meeting any scientific standards whatsoever. And what it really means is that they were not prioritizing high quality independent reviews, but instead they had this kind of we'll have a consensus and we'll support each other and then we're all happy. And this groupthink that happened within that meant that they agreed with each other, and thus they were even more convinced of how right they were because others agreed with them. And that consensus-driven thing was absolutely absent good scientific consideration. Certainly, there's a lot of warning that they were overstating evidence strength for interventions like puberty blockers and hormones. And then there were concerns about the level of activism that was involved instead of science. Some described WPATH as more of an advocacy group than a purely professional medical body with recommendations influenced by activist clinicians rather than evidence. Critics argued it created circular, self-referential evidence ecosystems rather than objective standards. I believe it. And then there were very, very specific concerns that related to youth and the absence of solid research about the very interventions they were recommending for youth. Like, you're suggesting we do these things on kids and adolescents, but we don't have a good evidence platform for it. So there have long been some divisions in the field about that, even evidenced by articles that were in the New York Times in 22-23. Including questions about what are the long-term outcomes of these treatments that we're pushing on children and adolescents. What about that persistence problem? Like this gender dysphoria that we used to see in kids would go away, but it's not anymore because you're blocking puberty. What about that? And is this actually a benefit to those kids or not? And then certainly why we are so rapidly affirming and moving people to medicalized treatment instead of dealing with other issues that might be relevant to the child, to their family, to their environment, et cetera. So there has been some real deep discussions within the field that pointed to some weakness that was absolutely represented by WPATH and their standards of care. However, in March of 2024, a major leak exposed internal communications that have raised some really serious questions about ethical lapses, medical malpractice for sure, and what has happened with the scientific or lack thereof foundation of these standards. So I'm going to give you some of the background to the leak, some key things that were found. So I'm going to cite some specific things that were in these files and what this really tells us about the issues related to informed consent, the hidden dangers of many of these medicalized treatments, and broader criticisms of WPATH. So the WPATH files were leaked in 2024 by a whistleblower, and they were given to journalist Michael Schellenberger. He was the founder of the think tank called Environmental Progress, and he's known for his work on both environmental issues and now free speech, because he's also one of the journalists that was given access to the Twitter files and really developed our understanding of what was happening inside Twitter before it was purchased by Elon Musk. So please note, Schellenberger is not a conservative, and he doesn't seem to have any ideological horse in this race. There's no reason we can see that for him to undermine WPATH outside of him thinking that this is stuff that the world should know. So he published the files with an analysis that was done by Mia Hughes, and the report was titled "The WPATH Files: Pseudoscientific Surgical and Hormonal Experiments on Children, Adolescents, and Vulnerable Adults." It's a great title to start with. Let's go. And this report included over 240 pages of internal messages in WPATH's online forum for its members that spanned from 2021 to 2024. And it also included emails, and it also had a video of an internal panel discussion on these topics. And boy, what it revealed was really mind-blowing. There were private conversations among these WPATH members, doctors, therapists, activists, etc., they had a great deal of influence over transgender health policies and practices across the entire world. And Schellenberger argued that these leaks were really demonstrating that WPATH was prioritizing activism over science and leading to what he came to the conclusion was widespread medical malpractice. And I really do agree with him. Now, please do note that these leaked files were authenticated, but WPATH claimed that they were taken out of context. So they're real, but you're just interpreting them the wrong way. So media coverage was actually quite widespread, and even liberal and progressive outlets like The Guardian described the leaks as very disturbing and highlighted concerns about what this meant for care for minors. WPATH responded by reaffirming that their standards of care are science and evidence-based. Just trust us because we said so. And absolutely dismissing the report as misinformation. Because if it's true, but you don't like its conclusions, you can just call it misinformation and go from there. That's the way it works. So critics, however, including some former WPATH members, called it a damning exposure of ethical lapses, placing this among the most severe historical medical scandals like lobotomies and the Stanford prison experiment, like where professional organizations ignored and covered up obvious harms. That's how serious people see this, and they're right. They should, because this stuff was absolutely shocking. And among other things, I want to talk about some of the highlighted problems that came out of these files. Some of it related to the fact that they absolutely acknowledged that minors cannot truly give informed consent for these procedures. One of the endocrinologists in a video panel said this, "It's always a good theory that you talk about fertility preservation with a 14-year-old, but I know I'm talking to a blank wall." He acknowledges that a 14-year-old is not going to really grasp the importance of fertility preservation. Like what you're about to do to your body is going to wreck your potential to ever contribute to having a child. And maybe you should think about that. A 14-year-old's not thinking about that. That's not what they care about in that moment. And yet they continue to do things to those 14-year-olds to take away that potential for them to either be a father or a mother down the road. Heartbreaking. Other discussions were about the sexual function impacts that come from these treatments as well. And WPATH President Marcy Bowers, who is transgender, male to female, said this: to date, I'm unaware of an individual claiming the ability to orgasm when they were blocked at 10 or 2. So these hormone blockers that they're giving to children at this 10 or 2 developmental stage, where they could be as young as 8 for a female and 9 for a male, they know that what they're doing could result in that child never, ever in their entire life having an orgasm. Do you think that that child knows how to consent to that? And I want to know, what about the mom or dad who says, yeah, it's okay. It's okay if my child never has an orgasm their whole life because this is so much more important. Oh, okay. Sure. I mean, that is a permanent loss of that potential. And you don't know what their life is going to look like. Crazy. They were very dismissive, even about cancer risks, because in that forum, there was a discussion of a 16 to 17-year-old who was on testosterone, developing large liver tumors that were possibly malignant, that was absolutely directly linked to those cross-sex hormones. And one member mentioned another case that was fatal of cancer that they believe was absolutely directly linked to cross-sex hormones. How do these medical professionals that are like first do no harm, like flippantly talk about giving children and adolescents these hormones when it has been linked to cancer and death from cancer? But this is so much more important than cancer. I can't. In other discussions, they were discussing, how do we get consent from somebody who's schizophrenic or has dissociative identity disorder or who is homeless? And anytime somebody brought up a concern saying to the rest of the people in the group, maybe if they are schizophrenic, they can't really give consent to these kinds of treatments. Or maybe if they're dealing with homelessness, that's something that should be dealt with first before gender dysphoria. Anytime somebody said, maybe we shouldn't move forward full steam with these, their concerns were dismissed as gatekeeping. You're just going to stop this person from getting the treatment that they want. Nothing should stop anybody from getting the affirmative treatment that they want. These were some complex mental health issues, and they didn't think they should be treated first. We should just maim first and ask questions later. And then they talked about some really extreme procedures. Like there were talks of gender nullification surgeries where you would remove the genitalia that was either male or female and leave them without any genitalia, so they can have a, completely non-binary body type. And in another one, they were discussing vaginoplasty on a 14-year-old. That is taking a male who has a penis and a scrotum and inverting one of those two things to create a fake vagina that would actually be a bloody wound for the rest of their life. That's not going to heal. It's not made to do that. And it's not made to work the way a real vagina is made to work. It's not going to end up well. But they were talking about doing that with a 14-year-old as if that's okay. And then in another case, they were talking about hormones for a developmentally delayed 13-year-old. So we know they don't even have the normal capacity of a 13-year-old. But that's okay. They want to be the opposite gender. So we should affirm and we should give them treatment, even though they don't even have the normal capacity of a 13-year-old. Crazy. In these internal conversations, they were absolutely talking about improvising treatments based on, whatever the child in front of them might think that they want. You're just going to make stuff up on the fly when you're talking about children and adolescents. They are vulnerable and they deserve the protection from adults. And instead, the adults were like, well, how can we harm them today? And even in this, there was very clearly an overall awareness of the fact that they were making stuff up as they went. So this is one of the quotes from Michael Schellenberger. He said, quote, "These leaked files show overwhelming evidence that the professionals within WPATH know that they are not getting consent from children, from adolescents, or from vulnerable adults." They know that. They know it's not real informed consent. It might be consent, but it's certainly not informed. So these citations reveal that members admitted treatments cause infertility, sexual dysfunctions, other harms, and yet they proceeded anyway. And honestly, I have started to wonder how many of these professionals were actually like sadists or sociopaths. Like, how do you be in the position where you're like, yeah, sign me up. Tomorrow I get to cut healthy breasts off of 14-year-olds. What? How do you go to work that day? That's crazy. So in another very chilling example, a doctor discussed a young patient who had a dissociative identity disorder diagnosis. So this young person believed that they had multiple personalities living within their body. And if you haven't seen how some of this is looking today, they might feel like one personality is a 17-year-old female and another personality is a 31-year-old male. And another personality, by the way, could be an animal or a character from a TV program. Like that's what this DID is looking like today in the way that it's described by these young people. And this professional says, well, the challenge of this surgery is that not all of the alters have the same gender identity. That would complicate consent, I guess. Crazy. So where the standards of care, they claim to be evidence-based, the leaks and the subsequent revelations actually proved otherwise. Because in the leaks, we discovered that WPATH commissioned a systematic review from Johns Hopkins in 2018. And then when Johns Hopkins brought them the results, they ended up suppressing those results because the findings did not support broad access to hormones and surgeries for these children and adolescents. So since their own systematic review did not come out the way that they wanted it to, they just buried the results of it. Court documents from Alabama lawsuits revealed that these WPATH leaders interfered with these systematic reviews to control outcomes, trying to actually alter data. Where it couldn't be altered, they just killed the study. Crazy. And then additionally, we find out that Admiral Rachel Levine, who is a transgender female, pressured WPATH to remove any age minimums for treatment of children in the standards of care. So somebody who identifies themselves as transgender said, we shouldn't say that you have to be at least this old for any of these interventions. We should just give them to whatever children and adolescents want them. That's crazy. Now, informed consent is an absolute cornerstone of ethics, and patients have got to understand the risks and the benefits and also treatment alternatives, especially treatment alternatives that might contain less risk. And the leaks show that WPATH members knew that this informed consent process that they felt like they were following was often failing, especially for these minors. Doctors admitted that teens cannot comprehend, they cannot fully grasp what lifelong infertility or sexual dysfunction looks like. And it is not even a guarantee when a parent is involved, because they also admit that parents may lack health literacy and not be good advocates for their children. They also admit that sometimes parents have their own agendas for encouraging their child to pursue identification with the other gender. And for vulnerable adults, consent is often given despite a significant mental health diagnosis. The rates of diagnosis of autism in adolescent populations that identify as transgender, it's very, very high. Also, we find schizophrenia, we find dissociation, a whole bunch of things. Capacity is highly questionable already, and then you're adding these high risk, low benefit outcomes. And then anytime anyone in those discussions said, wait, guys, maybe we should think about whether or not this person should be eligible for these kind of treatments. They were dismissed as gatekeeping necessary treatments, stopping people who desperately desired these treatments from getting what they clearly so badly need, and creating obstacles that are unnecessary. They were prioritizing access over safety. So WPATH also has shouted to the heavens that regret rates are so low that they're less than 1%. But the leaks actually suggest that there is significant underreporting of how many detransitioners there actually are. And in fact, today there's multiple subreddits for detransitioners, and some of them have over 60,000 people who are part of that subreddit. That's a lot. Even if you think that some of them are true detransitioners, that's still a lot. So maybe the regret rate is significantly higher. And especially now that we are going to just be starting to assess the ones that were just automatically affirmed from childhood instead of going through a Zucker type protocol. We'll see how this goes. So even The Guardian admitted that this problem with WPATH and the ethics related to the care of gender dysphoric children and adolescent, they said it isn't isolated. It's systemic. And I'm going to tell you, it is full on evil. And now I am going to give you my frank and unedited opinion on this subject. So buckle up. WPATH has tried to claim the moral and the medical high ground, but their standards of care have been about as evidence-based as a flat earther's TED Talk. They have blissfully turned vulnerable minors into guinea pigs in a grand experiment of affirmation over actual science. In the 8th edition of their standards of care, they casually ditch those pesky minimum ages for life-altering surgeries and hormones, because who needs proper assessment and treatment for co-occurring mental illness when you've got, vibes? Hey, 14-year-olds, you want to pause puberty forever, wreck your bone structure, brain development, and maybe never ever orgasm in your entire life? Cool, sign here. It's totally reversible. We swear. Except their own leaked chats admit that kids are staring at a blank wall when and if doctors hint about the risks. They cannot truly grasp them. Informed consent? That's not informed consent. That is like a payday loan company swindling somebody who is desperate and has no financial IQ. And let's talk about the puberty suppression game. WPATH hires John Hopkins to review the evidence and then sweeps the findings under the rug faster than a politician hiding his donor list because, surprise, it showed little to no evidence for the magical hormone cocktails. Instead, they cranked out guidelines that overstated the benefits, while at the very same time whispering in their private chats about liver cancer risks in kids. Activism over accuracy. Folks, that is the WPATH motto. Straight from the social justice activists who advise them to skip real science for gender affirming vibes. And all of those forum gems, they were debating surgery on teens who think they have multiple personalities, because nothing says ethical like operating on alters who may not agree. Or pushing gender nullification procedures to erase any hint of biological sex on vulnerable adults who are homeless or schizophrenic. Gatekeeping is so last century, according to WPATH, where doctors were quite content improvising treatments that could leave kids sterile, bone weak, and regretful. No wonder the Cass Review called it out as low-quality pseudoscience. WPATH is the overzealous life coach who yells, "Jump off the cliff, the net will appear." Except the net is made of low certainty evidence and buried systemic reviews. And these doctors and activists are not the ones who will have to reckon with gravity and face the consequences for rash decision-making or trusting doctors whose care is more malpractice than miracle. And I know that after that tirade, you're probably thinking, Linnell, I wish you would tell us more often what you really think. You should probably fear the day that happens. But until then, please push like and subscribe and the notification bell, because it doesn't cost you anything and it really does help us expand our reach. And until next time, grace and peace to you.
If you enjoyed what you just heard, we invite you to like the episode and, if possible, leave a positive review. If you know someone who could benefit from this content, please share it on your social media. We also ask that you subscribe and follow so that you don't miss any of our upcoming episodes. We are so glad that you chose to be with us today. We hope that you will join us again next week on The Theological Lens.